Okay, so I'm gonna present kind of my slides. Just give me a second. Okay, so welcome to our medicine week. So if you guys have been here, you guys have probably seen this slide about like 3 times. So if you haven't, then I just wanted to introduce myself. My name is Sania Majidar, and I'm a high school senior from New Jersey, and I love to run and play the violin. And these are some of my leadership activities that I have been doing for last year and this year as well. And I have over 300 hours in community service, whether it be hospital, volunteering, tutoring, or even shadowing. And I've also raised money for food banks and masks. So you guys can find me at those 2 handles. So what is Medical Wonders? It's a student-led and nonprofit organization to educate and advise students about the astounding medical procedures, careers, devices, and more. So we actually have 4 exec teams, researchers, editors, communicators, and graphic designers, and we have 50 tutors and 10 college overseers, as well as 200 plus general members. And we also have our pre-med med panel, which is about 15 pretty motivated pre-med students in their undergrad studies. And they kind of write articles and stuff like that, like the research team. And they also were on yesterday at 7:30 p.m. Eastern. So there are 200 plus people involved, and we've also reached many other nonprofits, whether it be collabing with them or just giving them small shout outs. And we have over 3.4K plus followers. I haven't been able to change it, but we've been growing a lot. Thanks to you guys. So I kind of wanted to go over Medicine Week. Some of you guys are new and haven't been kind of following along since the beginning of me announcing it on our organization. So every week, we're gonna have a medical professional or student go on Zoom with us for an hour presentation with introductions and, you know, study cases, which are optional, and a Q&A session. So our panel board is actually on our Instagram. You could check it out at medical.wonders for further information, but I couldn't fit everyone on the slide, so super sorry about that. So next thing I want to go over is how can I get these shadowing hours and our certificates? And if you don't need shadowing hours, these can also count as volunteer hours itself. And quick reminders, hold on, let me just, okay, so our doctor is here. Just give me a second. Hi, Dr. Meyers. I'm just going over an introduction, and then I'll give you a co-host. So yeah. So the next thing is the quick reminders that we have. So you must have attended 2 or more calls this week to actually have it count as shadowing hours. If you attended 1 or none, then it's not going to count as hours and you will not be able to get a certificate. And you must have signed up with your email and name on the Google form we sent out, just so it's easier to keep track of everything. And in order to verify your attendance, you must submit a 5 to 6 sentence paragraph of what the calls are talked about. So please submit it all at once when the week ends. People are still submitting me calls, and it's just really hard on my end to kind of keep track of everything. And I promise you will get the certificate and the hours itself, but if you put it all at once, I'm less likely to kind of mess up the hours and actually give you credit for what you guys came for. And the paragraph must be 5 to 6 sentences and in detail. So it's 1 paragraph per call. So if you go through all of the 6-day calls, then you will have 6 paragraphs, 1 corresponding to each call. So make sure you specify which Zoom meeting you attended and put your full name along with that paragraph so we can actually put it on the certificate. And you have to give us about a few days to a week to submit, so please be patient. And if you guys want to put this on your resume and apps, the 2 bullets are kind of how you would kind of describe it, but you can also describe it in any other way you please. And if you attend all the calls, you get 12 hours of shadowing experience because we have 6 callers lined up back to back. So yeah. So I'm gonna stop sharing right now, and I'm going to make Dr. Carolyn Meyers. a co-host. Okay, so I guess we can get started. Dr. Moyers, if you would like to turn on your camera, if not, it's fine, but I'm gonna actually give it to you now to kind of introduce yourself, and I have questions lined up also on the Google form, but you guys are also free to kind of answer it in the chat itself.
Okay, hi, and I might need your help just reminding me of those questions because I don't have them in front of me. I'm working today. They're on my phone.
All right.
Hi, everyone. I'm Dr. Carolyn Meyers. I'm a board-certified OB-GYN in Fort Worth, Texas. I reviewed the questions that you guys had last night. So if I'm understanding correctly, my audience are high school and pre-med students. Is that right?
Yeah, exactly.
Fantastic. Well, what an exciting time in life. And so you're trying to decide, is this something I want to go into? Curious about the specialty of OB-GYN. I will tell you a little bit about my journey. You know, when I was in the 4th grade, I wanted to be a hairdresser. Okay. I didn't know any professional women. I grew up in a very small town of 7,000 people. Then I was exposed to physical therapy and I thought it was remarkable. And this woman was working on a child and I was just mesmerized. So I went and volunteered at a physical therapy clinic and I was like, this is what I'm going to do. I researched all this schools and I was going to go to physical therapy school. And that's the track I was on heading into college. And my 3rd year of college, so I'm a junior in college, and I've got this inkling that I really want to be the expert. I really wanted to do more. And so I finally said it out loud. I think I want to be a doctor. And I didn't even know what that would entail. So I went and looked, you know, on the World Wide Web, you know, just looked it up. Like, what are the medical schools? What are the requirements? What do I need to do? And since I was on a physical therapy track, I already had all of the courses that I needed for pre-med, with the exception of calculus. But I had taken calculus in high school, so it was easy peasy. Added it on to a summer course, did it in a mini semester, and it was, I mean, just did it. I just decided I was going to do it, and I applied. And I did the interviews. I stayed in the state of Texas for, because we have, you know, if you're in state, better rates in terms of the cost of going to school. And we had 8 schools at that time in the state of Texas. So there were plenty of options. So I interviewed with several schools and I got into the osteopathic school, Texas College of Osteopathic Medicine. And I had a phenomenal experience. So when I got there, I will tell you, I had big imposter syndrome. And what that is where you're there and you deserve to be there, but you're not so sure. And you're pretty sure everybody's going to figure out that you are a fraud. I mean, I'm used to being like the straight A student, the top of the class. And all of a sudden you're amongst peers who are all at the top of their class. Everybody is the cream of the crop. And so it feels awfully scary. And so I kind of went through a phase of like feeling like, oh my gosh, do they really know who they let in here? Like, I'm just a small town girl. But I went into med school thinking that I was going to be a pediatrician because I really love that pediatric part of physical therapy. And I thought, that's what I'm going to do. And so went through the 1st and 2nd years. I'll tell you, you know, you've got an intense test every week, and then you go through your, you know, dissecting a human body in the lab with your colleagues, and test after test, you know, and you have these big landmark exams that you take along the way. And my first step exam, I failed. The reason I failed it is because I believed I was going to fail it. I studied incorrectly. You know, I just didn't study the way that I knew worked best for me. And you have to know your study skill set. Like, you got to med school because you're an excellent student. So don't get distracted by the study groups and the this and the that and all of the different things. Figure out what really works best for you and do that. So I got a little distracted and I let that self-doubt just kind of settle in, and I believed that I was going to fail. And so I walked into that test thinking I was going to fail. And guess what happened? Self-fulfilling prophecy. So I confessed to my girlfriends, because, you know, you become really good, close friends with your crew in med school in those first 2 years when you're going through all those hard classes.
Yeah.
And I just confessed, and they said, all right, here's what we're going to do. And we developed a study plan, and they kept me accountable, and they were outside the door to cheer whenever I finished my exam, and I passed, you know, with flying colors. And I didn't do that to myself again. So that is a big lesson learned that I hope that you would take, you know, just go prepare, over prepare, and then walk in with confidence, right? Don't let those little seeds of self-doubt and that negative self-talk get the best of you. So going through medical school, you know, I thought I was going to do peds. You get to do some rotations, then you get to choose some electives in third and fourth year. I chose to stay on an extra year, and I got there's a lot of schools who have dual programs. So you might be able to get your MBA, you might be able to get your master's in public health, a number of things. So I got a degree in clinical research and education, and did an extra year of osteopathic training. So I was actually teaching the hands-on courses for students who were learning the osteopathic principles and those, you know, hands-on techniques, adjusting the muscles and bones, and had my own patients in that time too. So I developed a different skill set. So finishing school, you know, I was told by the medical advisor I should be a pain management and rehabilitation specialist. This was nowhere near my interest or my wheelhouse. I loved OB-GYN. When I went on the rotation for OB-GYN, it lit me on fire. I was the student who was running to deliveries. I wanted to catch as many babies as possible. I worked with a first-year intern, OB-GYN intern, and just loved her. She taught me everything. She was right there between the woman's legs, helping me deliver a baby, teaching me everything. This is the first rotation I got to cut an abdomen open during a GYN surgery, and it changed my life. I was like, oh, the skies have parted. It was amazing. So I just trusted my gut. Like, I loved it so much, but I still went and did an extra peds rotation, and I considered surgery, and I considered all of these things. But when choosing a specialty, like, this is what you're going to do for the rest of your life. Don't do it for the money. Do it. Don't necessarily do it for the lifestyle. Do what you love, and then you can create the lifestyle that you want. So that's what I did. I chose to go into OB-GYN, even though I was kind of scared, like, oh, can I be a mom in an OB-GYN? And the hours are long, and there's always call, and, you know, I'm in the middle of a 24-hour call right now. But I have a rock star husband who's doing all the school drop-offs and the PD appointments and things like that. So it works. So my point being, I spent the first 5 years in private practice, and then I shifted and did hospital work so I can do shift work and have more time with my family. So you could work full-time, part-time. Like, once you put the work in on the front end, there's just so many options in terms of how you practice and the lifestyle you want. And you've put in the work, so you're compensated well. So you have those choices, but you don't have to work full-time if you choose not to, or you can work full-time and be a rock star. You can do it all.
Okay. That sounds really good. Thanks for the insight on kind of how it was. I'm sure people were wondering kind of how you got here. And so I just disabled the chat for a little bit. You guys can start asking Q&A and stuff. It's just a little kind of, it's a little like disrespectful and stuff, because last time we had a lot of people ask questions as people were presenting. So I just disabled the chat. But for right now, while you guys are kind of generating your questions, I'm just going to go from the Google Doc, and I'm going to kind of go in order of how they kind of chose, how you actually chose OB-GYN. I know you kind of said it was your experiences and stuff, but how did you actually truly know that you wanted to kind of go into that field?
Yeah, I chose the specialty that I really enjoyed, that I liked going to work, look forward to going to work every day on that rotation. That was it for me. I mean, I felt like an idiot on cardiology rotation every day. You know?
Yeah.
I didn't like internal medicine and the chronic illnesses. There was no solution. And, like women are motivated and, 9 months, you're going to have a baby. You've got abnormal bleeding. We've got solutions for that, So I really enjoyed the solution orientation and I really loved the variety of practice. So I saw somebody asked a question about like, what's a general day like? Well, it depends on what you're doing. So in private practice, you may be in the office, seeing patients, doing well woman exams, putting in IUDs, doing prenatal checks, and then you may be running over to the hospital to deliver a baby in the midst of that. Or you may have a half morning in the OR and you're operating, doing hysterectomies or endometrial ablations or a number of other procedures, tubal ligations, ovarian cystectomy. Like there's a number of operations that we do, and then going to the office in the afternoon. So there's just so much variety to it. One day doesn't look the same necessarily. As an OB hospitalist, that's what I've been doing these last couple of years. I helped develop a GYN practice last year, and that was more in office and then scheduled OR time. It was a lot more predictable. As an OB hospitalist, though, you're kind of running all over the place. So like currently we're in an OB-ED triage room. So I'll show y'all around here in a minute. And so I see all the patients who come in to OB triage, whether they think they're in labor, they think their water broke, they're having vaginal bleeding and concerned about the pregnancy. And I may be running to the other end of the hospital to the emergency department with a GYN complaint. So a gynecology patient, someone who's not pregnant, but maybe has significant anemia because of bleeding, vaginal bleeding, then they would be calling me to assess what's going on. And then I may be running to the labor deck to labor and delivery and delivering babies or helping out in the operating room with an emergency C-section or doing my own whenever a patient comes in and is unassigned. Okay. So there's just a lot of variety, and we're rounding on patients who get admitted to our service. So kind of all over the hospital, and it makes it exciting. It's not mundane.
All right. So that's just the second question kind of is like, what is the most challenging part? Like what struggles kind of come with being an OBGYN?
Yeah. So OBGYN, so I want to make sure that I say this, that OB-GYN, it's 4-year residency. You can subspecialize within OB-GYN. So you can be a reproductive endocrine infertility specialist. You can be a gynecology oncologist. You can be a urogynecologist. You could be a maternal fetal medicine specialist. So there are subspecialties within the specialty, but as a general OB-GYN, it's generally a pretty happy job. I mean, the worst parts are when a baby dies, when a mom dies. These are rare occasions, but they happen, or, just a poor diagnosis in pregnancy and it's going to be a poor outcome. Those are the harder things. And then diagnosing GYN cancers. So cervical cancer, breast cancer, endometrial cancer, like those are always kind of the harder pieces to the job.
Okay, I see. And the second question is what should pre-med students ought to know before pursuing OB-GYN as a career?
I don't think you're necessarily going to know. If you're interested in the field, I would say go shadow an OB-GYN in the office. I mean, that's probably the easiest thing to do, get permission to shadow them. And there's plenty of OB-GYNs who are happy to kind of share the specialty with a young and eager student and go watch a delivery, whatever you can kind of get your hands on to see if you really like it.
Okay, sounds good. The next one is what's the difference between an OB-GYN and a neonatologist?
So a neonatologist is a pediatrician. So they've specialized in the preemie babies, the NICU babies.
Okay. And the second one is, are there any surgical aspects present in the job of an OB-GYN?
Yes. So that's what I talked about earlier. There's a lot of surgical aspects. So in the office, you might be doing incision and drainage. You might be doing vulvar biopsies. You'll be doing IUD insertions and implant insertions and removals. There's plenty of in-office procedures that you can do. There's even some minor in-office procedures like hysteroscopy and things. In the operating room, you go everything from an exam under anesthesia to removal of the fallopian tubes to hysterectomy. There's just such a variety.
Okay, sounds good. So the last question on the Google Doc before we move to the actual chat in Zoom is what preparations in terms of skills would you recommend before attending med school and becoming a good doctor?
Just life skills, honestly. I mean, there are no specific medical skills that you need before going into med school. I mean, I can think specifically of somebody who was a paramedic coming into med school and they flunked out in the second year. I mean, it doesn't determine your success, a prior medical knowledge. So you're going to learn everything you need to know in medical school. So develop those life skills, those core skills, those personable skills, because what really makes you a good doctor is the connection that you can make with your patients and just excellent clinical care, you know, where you actually follow through, you're uncovering the pieces to the puzzle to try to really solve for the patients.
Okay, sounds good. So the next question is, were there any benefits to staying in one state for undergrad and med school? How did you overcome imposter syndrome?
So the benefits for undergrad and med school, well, for me, it was just financial. Like the in-state rates are so much better. So even coming out of, so my family did not pay for college or med school, so I had to figure that out on my own. Even coming out with in-state tuition, it was probably around $300,000 total for both. But what I did is partnered with the state of Texas and a rural community, and I went back to that rural community after I finished residency for 4 years of service, and that forgave all my medical school debt.
Okay, sounds good.
Yeah.
So the next question is, how many different rotations did you complete in med school?
I've forgotten. I don't know. I mean, you have core rotations. So like we did ER, we did surgery, we did family medicine. I did an osteopathic rotation. I did, peds and OB-GYN and surgery, cardiology, internal medicine. I mean, I don't know. I don't remember. You did ask about imposter syndrome, and I want to make sure that I address that. You know, that's more mindset work. That's more getting out of your own way. That's more really checking the story that you're telling yourself. And, is that true? Like really being curious about your thoughts. Maybe you need counseling, maybe you hash it out with a friend, but it really is just mindset work.
Right. So the next one is, what aspects of pediatrics did you find interesting, and how did you figure out that it wasn't what you actually wanted?
Okay, so I liked the kids. I loved the curiosity of the kids, and their the purity and I just loved the kids. I did not enjoy the aspect of the parents' complaints and the I don't know. And I got the sickest I've ever been on a peds rotation, and inpatient was very disheartening to me. So I just overall, it didn't light my fire every day, right? It was OB-GYN that did that for me. And so I just went with that.
Okay, sounds good. So the next one is, why did you decide to open a private practice instead of working at a hospital? I mean, now you do, but kind of like before, I guess, when you said that you worked in a private practice.
Yeah, okay. So coming out, I was actually hospital employed. So yes, I was in private practice, but it was owned by the hospital. When I came out, I wanted to be an excellent doctor. I did not want to run my own business. I wasn't taught the business of medicine, so that was not my focus. My focus was honing my skills and being the best OB-GYN I could be. I wanted to become robotically trained. I wanted to just be really comfortable in my own skin as an OB-GYN. And my community and the support that I had in that community, there were 5 other OB-GYNs. So there was a lot of support, a lot of providers with 13 plus years of experience to kind of support a new baby doctor. And it was a great experience for me. It was right where I needed to be. Now, when I finished that rural health commitment, I moved to a new community, a bigger community, and I took a job and it wasn't the right fit. It was a private practice job and it wasn't the right fit. And I left that job at the end of the year and decided to just do hospitalist work for a while. And it was kind of my holding place and giving me a chance to kind of figure out what I wanted to do next. The nice thing with hospitalist work is I was able to do shift work part-time as I wanted while I had small kids, and then work back into full-time. And then I thought, oh, I want to do a little bit more. So I helped start a gyn practice for another group that was doing hormone replacement therapy. And that was fun because it used another creative side of my brain, but I was still doing hospitalist work. And then this past year, I've been doing hospitalist work full time because it just worked better for my family. And I'm getting ready to launch a new adventure. So, the nice thing is you don't have to be stagnant. You don't have to stay in the same job for 10, 20 years. You can always change. You can adapt. You can pivot as your interest and life goals and priorities shift.
All right, sounds good. So the next question is, why did you decide to get an osteopathic degree rather than an MD?
Well, it kind of chose me. So in the state of Texas, when I applied, there were 8 medical schools, and it was all in one system. So you applied to the schools that you wanted to go to, those that liked you, interviewed you, and then you ranked them according. And so I ranked my schools and they ranked me, and it was a match. So I matched with the osteopathic school. And it didn't bother me. I didn't think, oh, I shouldn't do this. Now I had some family members who may have made that comment, but, I liked the philosophy that the body is a unit, mind, body, and spirit. It just kind of made sense, a holistic approach to medicine. And I would dare to say that, my medical degree would hold up against anyone else's. It was just a fantastic experience. It was a very, challenging and rigorous academic environment. So we have the knowledge base of MDs, but have this extra skill set of, manual physical medicine.
That's good. So the next one is, how was your experience with PAs been in the OB/GYN field?
Okay, so I've had several PA students. I haven't worked a lot in the office setting with PAs, but I have, in like first assist situations. So in the OR, being a great help. I would love to have one in my new adventure. So, I really enjoy training them. Their training is very different than a nurse practitioner. They're trained much more like a physician, and they're a great companion in the office. I have a cousin who is a PA and did her rotation with me, and I loved it. I loved working with her. She decided to go into like internal medicine, but in the OB/GYN world, they can really be of use, particularly in the office and first assisting in the OR.
All right, that sounds good. So the next one is, what kind of prenatal screening or testing do you usually advise?
It just depends on the patient in terms of like maternal fetal screening, or like, are we talking blood test or nuchal translucency? Like, there's just it's much more complicated than I think I can explain on this session.
Okay, sounds good. So the next one is, what would you do differently if you had to choose a major when you applied for college as a high school student?
Nothing. I went in as a biology major, thinking I wanted to do physical therapy. So in my third year, I was on the track for a biology major and chemistry minor, and I actually I pivoted. In that second semester of my junior year, I actually got a degree out of the family science department because I really want to develop those personal skills, because I said, I'm going to get all the medical knowledge I need, all the math and science I need in med school. So I have a minor in biology, and my major is in child development.
That's good. So the next one is, do you think it's difficult as a doctor that you have to make the final decision whereas PAs work with doctors? Do you ever have to like second guess yourself?
Yeah, any healthy doctor does. So, you have to know your limitations. I think that's one of the best things about, trying to be a good clinician, is that, you're studying, you're looking information up for your patients, you're leaning on experts whenever you need it. So if you don't know the answer, you know where to look for it. Even here in the OBED, where we're providing, excellent care for women in crisis in pregnancy, Sometimes I'm calling the maternal fetal medicine specialist and they're coming to scan the patient to give their expert opinion if we need to do something a little more.
Okay, sounds good. So the next one is, because you got a DO, how does it affect kind of your patient care and your practice and how you kind of problem solve throughout your day?
I think so in a typical OB-GYN setting, I will say it probably doesn't, except that, you know, the mindset is a little bit different where you're looking at the patient from a whole. Let me give you an example. Say a woman comes in with an enlarged fibroid uterus and it's been stable for 10 years. It hasn't grown in any size. She hasn't had any abnormal bleeding. And all of a sudden, acutely, she comes in anemic with a large vaginal bleeding. Well, have I evaluated her thyroid, or whether she's diabetic? You know, there's a number of other issues that could confound that bleeding versus just going straight for, oh, we're vaginal bleeding, we need a hysterectomy, you have enlarged fibroid uterus. Maybe that wasn't the problem to begin with. So that's just like one thought model to kind of consider is a more holistic approach. But then otherwise, it's this skill set that I have with my hands where I can actually do adjustments for back pain, pelvic pain, etc. You know, and just kind of help to optimize function and how patients are feeling.
Okay. So the next one is, what are the realities of being a doctor with children? Have you faced sexism or kind of discrimination because of this?
Oh, I love that question. So I kick it in the balls. Really. I ignore sexism. I mean, I don't ignore it. I deal with it face on. It certainly happens, you know, like people offering to take your call or thinking you don't need to do this, you don't need to do that because you have kids or you really want to be home, and just assuming things about your goals and your agendas. So I think it's really important to be clear about what it is you want, what your goals and your priorities are, and saying yes to those things that are on your priority list, right? So is it hard being a doctor and being a mom? Yeah, I mean, being a doctor is hard, being a mom is hard. No matter how you do it, it's hard. It's hard work. Being responsible for another little human being, and I'm responsible for 4. So it is challenging, yes, but it's totally doable. I mean, it takes a village, you know, like I said, I chose to work less, to go part-time for a while so that I had more time with my kids when they were little. And so I had more headspace because I have a lot of little babies and very little sleep. So I just needed a little more space to be an excellent mom and to be an excellent physician. So it's hard. You will face sexism. It just is what it is, but you have to find your girl tribe who's going to support you and encourage you along the way. There are plenty, like Instagram has been such a positive place for female physicians and for empowerment and leadership for women. So I would highly recommend, like, if you guys don't follow Natalie Crawford, you absolutely should. Or Mama Dr. Jones, if you're wondering about how to be an OB-GYN and a mom, like, I mean, she's a mama 4 too.
Yeah, that sounds really good. I definitely agree. So have you ever delivered a breech birth? Were there any complications, and how does the procedure affect your methodology of the extraction of the baby?
Good question. So less and less, I mean, the old timers are definitely doing breech extractions. I'm typically doing breech extractions of a preterm baby or in the OR during a cesarean delivery. So like a full term vaginal delivery, breech, not my comfort level.
Okay, sounds good. So the next one is, I think this is the last question. I think, Dr. Meyers, you were going to kind of introduce your office setting. So then I guess after you introduce that, if you can, we'll just ask for more questions about any of the equipment or something like that. But the last question is, what's one of your best experiences or stories with kind of being an OB-GYN?
Have a lot. Okay. Okay, I'll pick a happy story that I have. I had a patient who I got a call. I was in the office and I got a call by her urologist, and she was down in the ultrasound unit of the hospital crying. She was told she had an ectopic pregnancy. They were working her up for a kidney stone. She was a patient, become friend. I went to her side, supported her, encouraged her, looked at all the stuff, counseled her, took her to the operating room. There was bleeding in her abdomen, but minor, and I couldn't really find any evidence of an ectopic pregnancy. So I did minimal. I did not take a tube. I didn't get aggressive because there was no obvious source. So I told her after the fact, we're going to follow your beta HCG, your pregnancy hormone, and just be conservative because I don't know what's going on. So we did, and she did beta HCGs over, 48 hours, repeat. So I call her. I remember I was in between cases in the OR, and I'm sitting at the computer typing, and I review her records, and I'm like, her beta HCG is climbing. And she's like, wait, what? I'm still pregnant? I'm like, you are. So I send her for an ultrasound, and not only did she not have a renal stone, not only did she not have an ectopic pregnancy, she had an intrauterine twin pregnancy and went on and had a successful delivery of twins. So that's, a really fun and happy story. And sometimes it reminds you that sometimes less is more.
That sounds really good. So I think now you can kind of show like the office or something like that.
Yeah, I was working on admitting a patient, so I'm going to close this down so I don't share any patient information and then kind of show you around. So I'm not going to walk you through the hospital because then I have to put on a mask and it'd get complicated. But this is a typical triage room. So this is, we're walking in the door. We've got our hand sanitizer and our gloves. And then here is the patient bed. This is a typical patient bed setup. So these are our pelvic beds. So we actually have, can you see that, stirrups that come out?
Yeah.
So the patients can put their feet in, and then the bed breaks down. Well, not well. This one doesn't want to break down for me. Anyways, it typically breaks down so that we can do pelvic exams. So I don't know why that one's not working for me. And then a chair or two for the family members, and then we've always got suction at the wall. Our stethoscope is here, vomit bag, kind of your typical medical equipment. And then this is the external fetal monitor. So we place these little monitors. One monitors fetal heart tone and one monitors the contraction pattern. And then that will show up here on the screen. And then we have a pulse oximetry here that goes on the patient's finger. So, and then here's, the computer where the nurse would sit and do her documentation, or the doctor, sink for hand washing station, and then your sharps container. So that's typically it. I mean, got an IV pole.
All right.
Patients have a TV.
That's actually pretty cool. So does anyone else have any last minute questions? We actually finished really early, thankfully, but if you guys have any more questions, we still have about like 10-15 minutes to answer anything else, and anything about the equipment as well or something, if you guys had any questions about that. So Dr. Moyers, you can kind of, if you want to look at the questions and kind of answer them.
I'm gonna scroll through real quick and see if I have anything else.
Okay.
Do you think it is difficult that as a doctor you have the financial decision, whereas, final decision? No, we talked about that. That's the best part, is getting to make the final decision.
Yeah. So another question is, what times do your shifts kind of start and end?
Okay, that also depends in different, one hospital to the next may be different. So they can be 12 or 24 hours if you're doing hospitalist work. Now, if you're private practice, then you may be covering call for your group for 24 hours, and then you may have office the next day unless you choose to block that off. Or if it's weekend call, you may cover the whole weekend from Friday to Monday morning.
Okay, another one is, what did you get PCE prior to applying?
What is PCE? What am I missing?
I have no idea what that is.
This looks like Aditi asked that question. Aditi, can you clarify what you're asking?
Patient care experience.
Oh, patient care experience. Oh. So, I worked in a physical therapy clinic for a little bit. Because I thought I wanted to do that. And so I went and shadowed that. But I didn't have any additional clinical experience, no.
Okay, another one is, how do you know whether to react happily or not to a pregnancy? Because some people might not perceive it as good news.
Well, that goes back to your people skills and reading the room. You're sharing information. So here is something that I would really recommend, that if you're a physician, you remember you are there to serve the patient. You are, you go into it with a servant's heart. It's my place to help this patient. It's not my place to judge this patient. And so whatever the situation is, I'm going to provide them the best information and the best medical care that I can. So yeah, you just tell it like it is, that's kind of the approach that I take. I just tell patients like it is, good or bad, this is the information, and then you get to make the decision.
All right, sounds good. So another one is, when working with a PA, who would usually deliver bad news?
The doctor.
Yeah.
The buck stops with you, so you have to be comfortable being uncomfortable.
Okay. So another one is, could you go over how your loans were forgiven? Because apparently someone finds it really interesting on how.
Yeah. So I don't know in every state how it may work. There are different loan forgiveness programs. There's a nationwide program. But I went with the state of Texas, and they've changed the name a couple of times. So I cannot tell you exactly what it is now, but it was a rural health program through the state of Texas. And so I partnered with a community. So I had to go find the community and meet with the hospital CEO. They had to agree to the circumstances. And of course, they're like, you mean in 4 years or 8 years, we get a doctor? Great. So they signed on the dotted line pretty quick. And so the way it worked is that the state paid half of my med school tuition, and the hospital system paid the other half of my med school tuition. So every year they would send checks to the school and it would get paid. So then that debt I owed to the community. So if I didn't go back, I had to pay it plus interest.
Oh, okay, I see. That's actually pretty interesting.
Yeah. So I just applied through the state of Texas, and I can let you know what that link is. I'll need a minute to find that.
Yeah,
what
of course.
Rename the program as, and I can let you know so that you can share it.
Yeah, I definitely can.
Yeah.
Okay, so the next, how do you determine if HCG levels are normal, and can they help you determine abnormal pregnancy?
Yeah, so it's more than just one level, it's a trend. So are they trending up or are they trending down? And at what rate?
Okay.
Yeah.
So how was life as an intern?
How is life as an intern? Hard. That's probably the hardest year, because now you have the title doctor, but you're not sure what you don't know, and you're in your specialty, you're learning, it's on the job training. You're getting there's an educational component. You have 4 hours of lecture every week, and you've got multiple people overseeing you in those levels, so you've got an upper level and a senior, and an attending. So you are a low man on the totem pole. And my intern year was really challenging because I went through a divorce in my intern year. So there were a lot of little obstacles kind of to overcome. But But you get, I had a little bit of imposter syndrome again then too, but you just get through it. You just push through and lean on your support system, and you gain confidence. So by 4th year, I was sitting around chatting with the nurses, feeling very secure, overseeing interns myself,
Okay.
Yeah.
All right, so we're gonna take like 2 more questions. So what are the most common abnormalities that you have seen in pregnancies? Have you ever had to deal with an anencephaly? I don't know how to say it, but.
Oh, anencephaly. Okay.
Yeah.
What's the most common abnormalities in pregnancy? I don't know that I could say specifically the most common abnormalities in pregnancy. I mean, like preterm labor, preeclampsia, like those are pretty common. If we're talking about fetal anomalies, fetal anomalies are very diverse and can be very complex, and that is more the specialty of the maternal fetal medicine specialist. Anencephaly and trisomy 21 obviously are very common for fetal abnormalities. Anencephalic, yes, I've delivered plenty of anencephalic babies. They typically are born stillborn or maybe live a couple of hours. It's very rare that they live much longer than that.
Okay, so the last question is, do you have any other hobbies aside from being an OB-GYN?
That's a great question, because as an OB-GYN and as a mom, sometimes I ask myself that same thing because I'm constantly busy with kids. I like reading, I like cooking, I like hiking, I like water skiing, I like, a number of things. Do I give as much attention to those things right now? No, probably not as much as I should. So I kind of prioritize my family and my physical health right now. But absolutely, there is time and space to enjoy hobbies.
Okay, sounds good. So I guess we're gonna end it here. Dr. Morris, if you kind of want to put like your email and your Instagram, I'm gonna link it later after we end kind of this whole week, but you can put it right now because a few people might have questions. So
Like in the comments? You want me to put it in the comments?
Yeah, in the
Okay.
chat. So while she's doing that, I'm just gonna do a polling system. I'm gonna launch it again. If you guys were here, it's basically the same thing as yesterday. If you guys would like to record the rest of our calls and how well the call went. So please answer that really quick, and then we can end it. Okay, so everyone's saying that the call went pretty good and everything, and they would like us to record these calls. So, Dr. Murray, we're actually going to record this call, and I'm going to later put it up on YouTube as well, so other people can also see later, and
Okay.
they'll also be able to get shadowing hours at any time as well. So, yeah, thank you so much for kind of coming in here and taking time out of your busy schedule to kind of, educate the youth and stuff. It was amazing. This call was actually pretty amazing. I actually learned a lot. So thank you so much. And
you're so welcome. Thank you for organizing this. I love creative students.
Yep. Thank you. All right. So, yeah. So tomorrow, make sure you stay tuned for our call. I forgot the time actually, but it should be on our Instagram. And yeah, so thank you guys so much for coming, and you guys are free to leave now. Bye.
All right. Thank you. Bye.